Welcome back, dear viewers, with our second guest for today. As you know, we started talking today's episode with technology, and now with our second guest, we know that technology is reshaping healthcare, especially here in Kuwait, and pharmacy is no exception. In this regard, and in this interview, we are going to explore how coding and artificial intelligence can or are opening new opportunities for pharmacists here in Kuwait and in the region in general, and how digital skills can transform pharmacy practice and patient care. So, join me to welcome Dr. Ahmad Albaqsami. So, good morning, Dr. Ahmad.
Good morning to you. Thank you for having me.
Well, it's our pleasure. Before we go on air, we talked about that it is not just, let's say, an interview about pharmacists or pharmacy in general. We are talking about the digital transform for you personally. So, as a pharmacist, what motivated you to join the Coded Academy or program here in Kuwait, and what initially caught your interest and attention?
Well, if we're going to head back to the root cause, I guess I've always been that kind of person to, I like to improve my environment, let's say, whatever I'm working at. I like to, make it more efficient, consume less time in any way possible. I've always had this kind of thought process, but I never had the tools to know how to reach that goal. And if you think about it with AI or tech in general, I mean, what falls under that umbrella is AI and coding and programming, data science. The main target, the main aim and function of those fields is to make your job easier, I guess.
Exactly.
Work smart, not hard is definitely my logo, let's say.
That's also my logo, to work smart.
Absolutely.
Because working smart, that means less efforts and less, let's say, physical.
Definitely. And less errors.
Less errors,
Absolutely.
exactly. But let's talk about the coded program. Is it open for everyone, or for those who doesn't have any, let's say, technology or, let's say, tech or code literacy?
Absolutely. I mean, I came in the course I started in September. In August or any time before that, I had no idea about anything to do with coding or tech or AI or anything like that, but I had the passion, of course.
Yes.
Anyone that's willing to learn or has the passion can definitely achieve.
Just bring your laptop and go to the training.
Absolutely. And it's almost like they consider it as a challenge, the staff at Coded.
Yes.
For you not to learn, the passion and the ambition and the and how they insist that you learn is amazing, honestly.
Well, so they are using, let's say, reverse psychology?
Maybe, I don't know what they're using.
Or maybe they're raising the power of competition, that you can't do it because we are there, we are here, we are giving you the instruction. You can't beat us, you can't beat the system.
Probably, yeah, maybe that plays a part. I don't know what they're using, but it's definitely working.
Maybe because you are competitive, that's why you felt that the urge to learn faster?
That definitely played a part, I would say so, yeah.
Yes, that's amazing. So now let's jump to the third question. What message would you give to professionals? Yes, professionals, your colleagues in particular, to use Coded and start to have, let's say, coding trainings to assess them?
I would say, to be honest, for any professional that's interested in developing such a skill, not necessarily to one who wants to use AI or tech in general. I mean, the whole point, as we talked earlier, of creating a system or creating machine learning or anything to do with AI is to make your job easier, to make anyone use it. But if you're in the back end of it and you want to create something like this, you have an idea, an innovation idea or ambition in this kind of field, and you want to be the creator of it, then definitely it will be simply just minor coding and programming skills, like the ones that you're definitely going to learn in Coded. And some idea with data science, which is the course that I took. Funnily enough, the course that I took was data science and AI, so it's heavily based on data science.
Yes.
And the tool that you use to feed this science is AI, basically. And in a nutshell, I basically the course is not even to teach you terms of coding or programming, but it's definitely a side effect. And from that side effect, I've been able to, there's many doors that have been opened to me that I never thought I would.
So that proves the saying that preparation meets expectations.
Absolutely.
You need to have the proper tools, so when the opportunity presents itself, you can act. So You talked about AI and projects and innovation and creating something new. Now, tell me about, let's say, your AI project. What was the project about and how it's helping you in your profession?
Yeah, definitely. So there's two projects actually, but the first one is I'm going to talk to the one about the one related to pharmacy. So the pharmaceutical AI system is basically that I've made is a demand and shortage forecasting system. So it, in a nutshell, it basically predicts the demand and the shortage of pharmaceutical products for any pharmaceutical facility. So we're talking suppliers or hospitals, pharmacy chains. So, and funnily enough, I didn't even know this, but it's basically a supply chain management system.
Exactly, that's what I was, but you predict based on the market or the patient use or the hospital?
It's everything.
It's everything.
Yes.
It's like a prediction system?
It's a forecasting or a prediction system, exactly. And to bring a small example, it's basically the whole idea of this system is that it will predict, let's say for pharmacy A will need Panadol 500 for an example, in this amount, in that month, and you'll need to buy from this supplier with this amount because it's the best option.
Oh, that's amazing.
Yeah.
So it's going to be amazing if implemented in the Ministry of Health, especially now we have, let's say they are digitalizing the pharmaceutical or the pharmacy department using AI in all pharmacies, and you don't have, let's say, you don't need to go all the end of the lane just to pick one medicine and go back to the window. No, AI is there, technology is there. It's going to make life easier, faster, and more, let's say, efficient.
Absolutely.
Yes. Now, my next question is, how do you use artificial intelligence tools and technologies in developing, let's say, the project? You said that you work based on the scientific data given to you. How do you use them to, let's say, employ them?
So there's two sides of it. So there's absolutely the scientific side, and then there's the AI side. And in regards to the artificial intelligence and how I use this in this project, basically it's all to do with data. So the building block of artificial intelligence is called machine learning, and by the name, it's basically a machine that learns. So what you do is basically you teach it, you give it instructions, you give it the data, so it knows what is it going to learn, and how does it process it, how can it interpret this information. In that sense, I've basically collected data of pharmaceutical products. I had 2 million records. This was just a startup to produce the machine learning in the beginning.
So that helped you, your pharmaceutical background helped you to, let's say, create your firstborn project.
Without a doubt, yes. You definitely, maybe for some projects you wouldn't need an expert eye in the matter, but for some projects you definitely need it. So in my case, for an example, let's say to do with, only an expert or only someone with experience in that matter would get an eye on if there's a correlation between two columns or between two statistics. Let's say, for example, the formulation of a medicine and the price. So maybe someone without any experience in the matter wouldn't think there's a correlation.
You need someone in the marketing and finance department, and also you need someone in pharmaceutical.
Absolutely,
Two hands to clap.
Without a doubt.
Yeah, that's amazing. So tell me about the challenges that you faced during creating that project.
So I would say the biggest one is to do with data. I talked about data a lot today, I know.
No, because data is, let's say, the biggest challenge anyone in technology or in coding is facing. If there is a shortage in data, if there is a shortage in information, the project will be delayed, maybe cancelled, maybe, let's say, ruined or used.
Yeah, absolutely. And it's the fuel. It's the fuel of AI as well.
Exactly,
the more you feed it, the more it's going to grow. So that was the biggest issue that I've faced. Thankfully, I've been able to overcome it, but it's still, again, the more you feed it, the better it becomes. So the data, I had 2 million records almost of data to do with pharmaceutical products, but the problem was that the range of years was too short for the AI to understand and be able to comprehend the data.
Okay, my question is non-related to the questions I have. Is these data based on Kuwait or in the region?
So that was the problem. Is I wasn't able to obviously get this data based on real data in Kuwait at the time, because I had a short amount of time to create this project. So that's why I use data from outside of Kuwait. There's data available on variable websites so you can gather.
Yes.
After, data cleaning is one of the most essential steps that they taught us in coded, and definitely you need it in terms of data science and AI to be able to clean data, but some data is simply uncleanable.
Yes.
And that's what I figured out after 3 weeks of trying to work with this data. Funnily enough, that's why my graduation project in coded wasn't even to do with this with this system. It was a football system that I created with the help of my colleague Nizar Layoubi. I'll have to bring his name. And but thankfully, after graduating, I'm still working on the pharmaceutical product now, and I've been able to develop it. But of course, more data means a smarter and a
more
bigger,
efficient, more
definitely.
Yeah. So, can you use, let's say, hypothetical data to proceed with or you need correct data?
That's a beautiful question, by the way. And it was one of the ideas that I had to fix the project before. But sometimes it doesn't work. It depends on the situation, let's say. It depends on the target that you're trying to achieve. In my case, it definitely doesn't work because it's to do with time. So it's forecasting and predicting based on time.
Yes.
And a big aspect of my project is basically predicting trends. So let's say I'll give you a target, or I'll give you an insight that for this pharmacy there will be a trend in this medication and you'll need this amount. So for that you'll need a big data across time, and for that to make it synthetic or to create a synthetic data, it wouldn't be accurate and it wouldn't be in the favor of this AI system.
Exactly. This is amazing. But now, from your own perspective as a pharmacist, do you think AI transform the future of pharmacy?
Absolutely. I mean, AI linked with any field whatsoever will definitely transform it, make it more efficient, as we said. With pharmacy in specific, there's the beautiful thing about pharmacy is that it has many doors in terms of either healthcare operations, administration, or the clinical part, of course, the most common one, or even the marketing or the business sense, which my project is basically related to. Anything AI-based linked with pharmacy will definitely make it more efficient and reduce errors, which is a very critical part, basically.
Exactly. Well, Dr. Ahmad Albaqsami, thank you very much for joining us in Kuwait, Good Morning Kuwait, and I wish you all the best in your project because it's extremely promising, and may, inshallah, the Ministry of Health adopt this kind of project because it's going to be extremely efficient and will help the ministry distribution system or the logistics system in the ministry. So with that, we end it with our second guest, Dr. Ahmad Albaqsami. So stay tuned after the break to see what we have left.